All right. Thank you all again so much for taking the time to join us today for our session on checkups and children's books, partnering for early literacy. This is kind of an overview of a partnership that has been ongoing since 2024 between the United Way of Rock River Valley and Reach Out and Read in Illinois. We appreciate you taking the time again to join us. If you have any questions throughout our presentation, please pop those in the chat. We'll address all Q&A at the end of our time together. If you need anything or need to step away, the session will be recorded and available on our website at a later date. But again, thank you so much for taking the time to join us, and I am honored to introduce you to our co-presenter today, Jessica Iasparro. She is the Director of Community Impact at the United Way of Rock River Valley. I'm not going to go too much into details into her bio because it will address most of these things throughout our time together. But yeah, again, this is a session just really about this partnership that we've created, as well as practical advice for moving forward with any type of similar aspect of a partnership moving forward. And with that, I'll pass it off to Jessica for our first slide.
All right. Hi, and thank you, Olivia and Reach Out and Read Illinois for having me today. This is one of my very favorite things to talk about, how we partner with Reach Out and Read and how it has been I think, a great partnership for both of us. Just to give a little context to this relationship and where the United Way is right now. So I am the Director of Community Impact for United Way Rock River Valley, and that covers all of Winnebago County, which is right central northern Illinois. We go up to the Wisconsin state line and then just a little bit south of Rockford. And in my role as Director of Community Impact, I oversee manage and am responsible for the strategic direction of all of our community facing programs. Our largest community facing program right now is United for Literacy, which aims to drastically improve the reading proficiency of children in Winnebago County. United Way is a worldwide organization. We are, very prevalent in the United States. And I think there's a really unique opportunity for partnerships with the United Way now because of the change in the way that United Way funds programs. And really for a very, very long time, up until about 4 to 5 years ago, the United Way funded programs all throughout the community were in education or health or child welfare, and would grant out to maybe 50 different organizations. Here at United Way Rock River Valley, we did have about 45 different not-for-profits that we would give money to. And we've really had a shift in the way that we look at community impact and the people that we are granting money to, being that instead of going kind of the mile wide and an inch deep, now we're utilizing a collective impact process to bring together the people in our various communities. And with that group of people through the collective impact process to try to identify what the most pressing problems in the community are. And within the United Way framework, all United Ways put their community initiatives into one of four pots. And those pots are healthy communities, community resiliency, financial security, and youth opportunity. Our United Way with United for Literacy falls under youth opportunity. So I think there are many different, depending on the United Way, there are many different places that Reach Out and Read could fit within the priorities of United Way. So that's a very broad overview of United Way and where we're at now. United for Literacy, which is our literacy initiative, began in September of 2023. I began in this role in October of 2023, so I've seen it kind of go through its growth. And we formed this with over 30 different organizations in our community. And the thing that we kept hearing was our kids are not reading well. Winnebago County is not different than the rest of the country in terms of having children who are not reading proficiently by third grade. In our county, about 30% of kids are reading proficiently. We have one major urban area, which is Rockford. Unfortunately, the kids in our area, it's more in the high teens to the 20s. So really seeing a crisis there, and this is preaching to the choir at this point. Everybody knows how important it is to read in third grade, but as we go out and try to talk to people about why this is so important and why we're doing this, it is because of all the negative things that are positively correlated with not reading well in third grade, including, not great, being 4 times more likely not to graduate from high school, absenteeism, being involved in the criminal justice system, chronic underemployment or unemployment as an adult. And I think we all know the statistic that 70% of our prison population is functionally illiterate. So with knowing that a lot of really bad things happen if you're not reading proficiently, and conversely, good things will happen in your future if you are proficient in reading. This is how we land it on having childhood literacy be our initiative. So you can change the slide, Olivia. So, like I said, I came into this at the ground level. And when we started really looking at, like, this is a very complex problem that it doesn't exist in a vacuum. Um, and there's a lot of pieces of this puzzle to try to start to move towards any sort of system change in your community that could start moving the needle on this number. So the first thing I did was really, who else is doing this? We don't want to reinvent the wheel. So in that first year, really started looking at, it always sounds so clinical, but literacy interventions that were cost effective and evidence based, and that were research driven. So I was really happy. I found Reach Out and Read, and I think that I have done probably more research on Reach Out and Read than than most people. I can, with my clinics, I can tell you anything you want to know about Reach Out and Read. But what became really, really attractive about Reach Out and Read to us is that, we started looking here at third grade reading proficiency, and then we took a few steps back and, look at the research, and it's going to tell us that the best predictor of a child reading in third grade is a child having basic early literacy skills when they enter kindergarten. So then when you look at that, that is what really gives you the view of, we have to look all the way as far back as we can look, which is prenatally, to be in contact with these parents and caregivers who are shaping, through their child's first teacher. And how can we position ourselves with other partners so that we're supporting parents and giving them the skills and the confidence to be able to be early and consistent book sharers. So after we found Reach Out and Read, found out that we really, in our large community, did not have a presence with Reach Out and Read. We have one clinic, which is part of Miles Square in Chicago, that does Reach Out and Read here, LP Johnson, and they were wonderful. They let me come and tour around and talk to them and kind of get a feeling for it. And United Way, being primarily a fundraising organization, we have to look at wherever we're going to invest money, being good stewards of our donors' money. And are we doing things that are evidence-based, that are data-driven, and that are proven to really work? And can we afford to do this? So Reach Out and Read really, for us, checked all the boxes to start weaving literacy in from birth, in an area, in a pediatric or family practice office, where we know that over 90% of all parents, regardless of demographics, that will go to at least 2 well child visits. So that's how we landed on Reach Out and Read, and we can go into the next one. So I think United Way, I might be biased, but is a perfect partner for other Reach Out and Read clinics. But I think that if you're a clinic that's looking to get funding or to start a clinic, and you really need the partnership, maybe financially and logistically, the first place to look in your community is who else in your community is working in the space of literacy. United Way, I think that you're going to find many, many United Ways throughout the country where literacy is either their primary or at least one of their initiatives. The community foundations are great places to look. They'll generally have 1 to 2 times a year, to put in proposals. Kiwanis Club. We have a Kiwanis Club in Rockford that runs book donation drives for us that bring in over 10,000 gently used books a year. It is one of literacy is one of Kiwanis's primary focuses. Rotary clubs, Junior League. We partner with Junior League in Rockford, and they do a lot of stickering books for us. And it's a matter of looking around. I think sometimes when clinics are within a health system, that it's hard to look beyond your health system for funding or for help. But Reach Out and Read really provides such a unique opportunity to be a good partner that I think I think that clinics, healthcare organizations who look, I don't think it will be that difficult to find someone who you're a good fit with. So anyone who does literacy is hot right now. You can move it on, Olivia. So, in terms of kind of the nuts and bolts and what does a partner look like, I think the first thing to determine as a clinic whether you're trying to start from scratch or whether you've gotten to the point where you need funding or you need someone to come and stock your books for you or organize your books. So really think of what is when you find an organization like United Way or a community foundation, what is your ask of them? Is it going to be primarily financial, or is it going to be a partner to help us to get our clinic up and running? How long would you like them to be involved? And I think that's a big one because for when we started these conversations with the health systems in Winnebago County, um, a big part of that conversation was talking about sustainability because we can bring something to get this started and fund it and get buy-in within the clinics, but it is not our intention to fully fund all of our clinics forever. So we have put in that worked for us is that we're going to make at least a 3-year commitment to doing these things for you. And then, in the second to third year, we're going to start having conversations with your foundation or fundraising to try to, as like I said, as we're a fundraising organization, who could we connect you with in terms of corporate sponsors that might be a great fit and would love to, make a $10,000 investment to buy your books for the year to have a sticker that has their name on there. So, what do you want them to do? How long do you want them to be involved? And then this is really big, especially for a United Way, is how can you show impact? And we know that Reach Out and Read has great national data, and we use that all the time. But my fundraising team, when they go out, they want to be able to tell stories. They want to know what it looks like, which does is a little bit of a challenge sometimes because we all know that we are, bound by HIPAA. So we can't bring cameras in to well child visits. But you can share obviously your data from your well child visits. And we get the data back about percentage of books given versus well child visits. We've started talking to some of the providers and in the clinics that we're supporting about doing testimonials from their end of it. And then working with Crusader Community Health, we met with them last week, and I think moving forward we'll be able to get some footage of well child visits there that that have the appropriate things signed off. But there's a real thirst with donors of don't just give me that you gave 10,000 books out. Tell me about a mom who brought her baby in and this was the first brand new book that they had in their house, so things like that. And that's just to think in your mind as a clinic or a health system. If I find someone who's willing to give me something, what do I have the ability to give back to them? So, okay, we can go to the next one. So, I will let you know what our United Way does. And I think we're at 19 clinics. We have to find one more to get up to get 20 set and run. But for the majority of those, except for one of them, they have been starting from the application process up. Um, so what we do is once we have the okay from the health system, and I think that's a really, really important part, from my side of it, is we had to look higher up into the health system to have it trickle down instead of trying to have it build up. So really first started our conversations with um, kind of upper management in all four of our health systems, got buy-in from them, and then it trickled down to the clinic. So when it got to that point that we had a clinic that they identified that we were going to start the approval process on, I would meet with them and then I would link them up with Olivia. And then Olivia got to chase them down for anywhere from 3 weeks to 6 months to get the staff trained and get all of that done from the reach out and read side. So what I did on my side as a funding organization, while they were going through the process, I would schedule the time and I met with the entire staff, providers, even the front desk staff. And I would quickly give them, I usually took about 20 minutes, and I would give them background on United for Literacy. I would let them know what the situation is in Winnebago County about how few children are reading proficiently and that they have a superpower here. They see parents a lot, they're trusted by parents, and now instead of just saying you should book share with your child, now they have the ability to talk to them about book sharing with their child and give them the material to book share with their child. So we would do that orientation. And then when Olivia gives me the thumbs up, then we schedule a time, go in. We at United Way we probably keep about a 2 or 3 thousand book inventory at any given time, and we have them laid out and stickered and marked by birth to 5 months, 6 to 12 months, 15 months to 30 months, and then 3, 4, 5 year. And I will go and I will stock clinics. Sometimes there are some clinics that, twice a month I will deliver 300 books. There are some clinics once a month I might deliver 80. We're trying to get one of the things with the partnership is getting the cadence of what your well child visits look like, because nobody wants to keep 2,000 books on their shelves in their clinics. And that was one of the things that I think scared people off at the beginning was, where are we going to keep all these books? And there's not that many books that you actually have to have there. So we order the books, we pay for the books, we inventory the books, we record keep on all the books. And I stole my record keeping from Mile Square. See if I have some. Oh, I actually do have one of our books here. This is one of our very favorite books for birth to 5. So we'll have a birth to 5 months is our green sticker. So we'll put all those stickers in, shelve them, and then as they select the book for the family, they take the bookmark out, put it in a bin, and then when I come back and restock their shelves, I take all of their bookmarks, I count their bookmarks, I record their bookmarks. Every clinic has a spreadsheet. And then when Olivia comes asking for their 6 month report, I get a panicked email like, do you know how many books we gave out? I'm like, I do know how many books you've given out. And I'll send that back to them. And the thought behind all of it is doing this logistic work is that once we know the cadence, like I said, once we know what this looks like, once the spreadsheet is already set up, it'll be very easy for that clinic to take that over by themselves, because it's not making up new processes, it's not finding a place for the books, it's just starting to do it on yourself. The other thing I do is make sure that if there's the site support meeting or if there are webinars, I send that out to all of my office managers. So I'm trying to I'm trying to encourage them and tell them about all of the resources that Reach Out and Read has. So I'm kind of their link right now and their bridge, Olivia and I together. And the goal of that being is that the clinic over these 3 years becomes invested and the families become to, expect this book and like this book and like this as being part of a well child visit so that it's so embedded it will be an easy ask for a foundation or for a corporation to take over. So, all right, you can go to the next one.
Beautiful. And this is where I'm going to take over.
Okay.
So we at Reach Out and Read obviously have wildly been amazed by this partnership with the United Way. But this is a very hyper-local example of a partnership that has existed, and it currently is not being translated universally across the state of Illinois. So one thing, and one of the driving factors to why we've done this session today and have done this session in the past is we really wanted clinics to feel empowered in leveraging their case for reaching out to a community funding partner or thought partner and moving forward in a collaborative effort to improve Reach Out and Read, either in book distribution rate and access to books, in diversity of linguistic offerings for their patients and families, and things like that. And so this next little section is just about the research because, as Jessica mentioned, Reach Out and Read is a very heavily backed organization in terms of the research that is available. Rachel just put in the chat a link generally to the research library that's available through the Reach Out and Read national website. I have a few specific research articles I'm going to be talking about, and I will pop those links in the chat as I bring them up. But the very first one, and this is something that I'm really excited to see come to fruition through our partnership with the Winnebago County Clinics, is just the Reach Out and Read ability to improve well child visit attendance for patients and families. Realistically, parents might not be attending every well child visit from that birth to age 5 or even beyond time frame. And so establishing these relationships rooted in a mutually beneficial, and I don't mean that in the fact that there's not other mutually beneficial aspects to well child visits, but this is something I feel like parents and caregivers often see as an investment in their child's future. And then they feel as if they are like an integral part of the community. And then they are wanting to come back and they are wanting to continue to go to their well child visit exams because they're seeing the investment in their child beyond the immediate need at that current point in time. I put the link for this specific article, and this article also talks about the ability for Reach Out and Read to address social drivers of health. Social drivers of health are a huge component of public health and pediatric health as well. And it's really just the ability for Reach Out and Read to address the other factors that might be contributing to a child's health outcomes, both in the immediate need from birth to 5 age range and beyond. Because those social determinants or social drivers of health really do indicate the ability for a child to thrive and succeed as they move throughout the future. And this relatively small intervention does have the capacity for improving those social drivers of health. Additionally, Reach Out and Read enhances developmental surveillance. Let me pop that link in the chat. So kind of like how Jessica was talking about those anecdotal aspects of the Reach Out and Read well child visit, where parents are seeing, caregivers are seeing the ability for other things to be recognized through this small intervention of book sharing with the provider and book reading and guidance outside of the well child visit exam. Providers are able to observe those fine and gross motor skills firsthand when they give the book to the child. There's a clinic in the Reach Out and Read Illinois network where I've worked with them personally, and there's a very small anecdote of one of their patients. They had a patient and their caregiver come to a well child routine exam at the 6-month well child visit, and they were able to determine that the child needed external intervention for a gross motor developmental delay. And so they were able to get that help. And the reason they discovered that is because when they handed the book to the child was not able to do what they should have been able to do at that age point in terms of holding and turning pages and grasping and doing all those aspects that kind of you recognize, but you don't see it firsthand until you add something external that is physical that you can really observe the child interacting with. That's just one small example, but there are many different ways in which developmental surveillance can be used through the well child visit exam, specifically with books, through the Reach Out and Read model. Additionally, and this is one that we talk about a lot, Jessica asks for this one all the time, but providers in the clinic, regardless of if they are a clinician who is providing the well child visit exam, if they are a rooming assistant, if they are the front desk staff, if they're anyone, reach out and read typically enhances clinic morale. I mean, this is not a surprise. Oftentimes, providers are bogged down by a lot of different things, and to have that moment of joy with a book in the exam room, whether that's picking out books, organizing them, seeing what new books have been published, seeing what's available, really understanding your patient and their family and their interests, and kind of categorizing your choice for selection based off of what you know about that patient. All of those things contribute to an aspect of joy that, not that it's lacking in the clinic, but it's just really not easily tangibly recognizable outside of the reach out and read model. And then finally, reach out and read is proven to improve patient clinician relationships. This is something that I kind of mentioned earlier. It's mostly in relation to just that investment that the parent or caregiver feels from their provider. They view this as not just a situational thing, but they view it as a long-term investment in their child's health, well-being, and future generally. So all those links are in the chat now. They are also all available on the Reach Out and Read National Research Library. If you just go to reachoutandread.org, on the top right-hand side, there's a research library button. If you click that, you will be able to view all of the articles. There has been a lot of articles that have been published. This is a very research-backed organization. And this is something that I did want to highlight because we know that it works at a local level, but to have that research backing to it and have access to that to make a case that it's not just anecdotal evidence that you're seeing day in and day out, but it is a research-backed organization and program that you're able to leverage yourself in terms of the investment that a community funding partner or even just a thought partner could have in general in your organization. This could work at the clinic level or beyond too. And then I do have just a slide. This is again available in that research article website, but just that beyond all of that too, it is also a literacy intervention too. And so it has been proven to increase the ability for children and families to read at home, book share at home, as well as increase language ability, development, and all those things too for the children specifically. But those are just some things I wanted to note. And then we're going to talk specifically about the partnership that Jessica and I have worked together on. So we've heard how it comes together, but here's the numeric data that really kind of backs up what we've been doing. So again, this started in 2024, so I have some information pre-partnership, and then I haven't updated this since January, so it's a little outdated. We are up to 19 clinics active in the Winnebago County area currently. But yeah, we really didn't have too much of a footprint in Winnebago County. And I think that this is a great example for those that are not a part of a Reach Out and Read clinic to see that at an affiliate level or the national or the nationwide level, you may know your geographic footprint well, but you're not specifically in every individual community across your state or your region or anything like that. And so really understanding these specific community needs might not be firsthand your strength. And so finding these partners that are willing to invest in their own communities where they are aware of their community need and other aspects that you just don't have the capacity to be aware of, that is really integral to really not just expanding your footprint across the state, but really reaching those families that really would benefit from a program like Reach Out and Read. And what you do from there is up to you realistically in terms of how you partner with funding or assistance or whatever that may be. But it's really just an intimate knowledge that a partner can provide that you might not have access to. And yeah, do you want to just talk us through, Jessica, what the history of the partnership has been?
Sure. Let me look through this here. Well,
Yeah.
let's see. So I think I started stalking Reach Out and Read Illinois about winter of 2024. Yeah, and like Olivia said, we had just Mile Square and one of the UW clinics, which is actually based, I think, in Mendota, but Dr. Koskovich was up here. Um, and it was just a lot of boy keeping the the foot on the gas, trying to be trying to be persuasive without being nagging and getting the message through, over and over and over. And it was nice to see that grow. And they kind of came on as health systems. And we've seen it grow like that. One of the things that I'm really pleased about with this partnership is, um, as you saw in the intro, Crusader Community Health is our FQHC in Winnebago County, and they also deliver a little over a third of the babies in Winnebago County. And as of the 13th of January of this year, we cover all of the pediatric patients with Reach Out and Read in Winnebago County. So it's just been nice to see that grow. And some of the things that we've been able to do with our clinics is one, we provide bilingual books. So when I go in and I do the kind of staff orientation, I'll ask them to give me kind of the makeup. And we always assume they're going to be English and Spanish books. In our community, we have quite a few that we stock. A fair amount of Swahili books and Arabic books, Burmese and French. Those are our largest ones that we always keep an inventory of. But it's nice to be able, and we get a lot of great feedback about that, that parents, especially who might be learning English, like to receive a book that's bilingual in the language that's spoken in home. And this is a little bit off topic, but the other thing that we do, and I think it probably works best at Crusader, is every clinic or pod within the clinic has a book, and we call it, we have to think of a better thing, that we call it the sick visit sibling basket. And what we really want them to do is every single time a child under fifth grade comes into that office, they're going to walk out with a book. Um, and we provide a ton of, and for that we just have English and Spanish for the most part. But we provide baby books all the way up to early readers and chapter books, and we do that a couple different ways, mostly through our bonus books that we get through All About Books or Scholastic. We have a partnership with an organization called Our Kids Read, and we're able to get hardcover books for about $2. And then when we do our community book donation drives, we're just finishing one up today, we'll get a lot of those early chapter books in really good shape. So the ones, we'll put those into the sick child and siblings so that they get those. But we always make sure to tell the providers, the well child visits, they get a brand new book. So those are never, donated. But yeah, so we're proud what I would like to have Winnebago County look like. And we're not too far from there. I don't think that if someone's insurance changes and they need to switch over into to a different pediatrician or a different family medicine practice with a different health system, they will receive books when they go to that thing. We also utilize the Reach Out and Read model with the Winnebago County Health Department through their WIC program. So we currently have 5,000 families signed up through the WIC program who need to come in office twice a year to meet with the nutritionist. So we have, like I said, we have not certified, trained them on the model of providing that literacy instruction. So we do about 11,000 books a year through the nutritionists at the health clinic. So we also provide books to all of the home visiting organizations. That's about 1,000 families a month. So our hope is that a lot of these families will receive this message from their pediatrician or family medicine doctor or nurse practitioner. They're also going to receive the same message from their nutritionist at WIC. They're also going to receive the same message from their home visitor. And that all of those touch points, they're going to receive a brand new book. And we're going to be building the parent or the caregiver or the grandparents skills at book sharing and confidence in book sharing. So that's the hope.
Absolutely. Real quick, I'm going to run through some upcoming events for Reach Out and Read, and then once Reach Out and Read Illinois, and then once we have done there, we will start with our Q&A portion. So if you have any questions, feel free to pop them in the chat at this time. So I do want to just highlight we have 3 upcoming events before the end of June of 2026. We have a webinar session coming up on May 11th. It'll be a continuation of our content from last March, which is a recorded session on our website available. You don't have to have attended our previous session to benefit from the content of our upcoming session, but it'll be really about building relationships and fostering development through play with neurodiverse children. On June 10th, we will have our in-person Reach Out and Read Illinois annual fundraiser at the Dawson in Chicago. And then on June 15th, we will have another listening session. This one will be about Reach Out and Read available program enhancements, whether through Reach Out and Read Illinois specifically or through Reach Out and Read National, such as additional trainings, resources available, book lists available, or any supplemental training that might be beneficial for any provider or clinician in clinic. But with that, I'm going to go ahead and stop the recording for now.